Nancy, such a pleasure to welcome you.
Thank you. It's great to be here.
It's amazing to learn from you that you run a Ford healthcare system, a $5.5 billion in revenue, so 30,000 employees. I don't think many people know about this.
Well, we've grown a lot. In fact, in my 18 years at Henry Ford, we've gone from a $2 billion organization to $5.5 billion, from about 10,000 people to almost 30 now. So we've had a lot of growth.
Nancy, the most important thing, especially when you come to attend conferences like this, is to understand how healthcare systems leveraging technology, and it's a big part of what you do.
Technology affects everything we do. If we think about a medical device, we think about monitoring systems, the electronic health record, the business systems that help us provide the supports for the care process. Technology is absolutely inherent in everything we do.
If I were to ask you in 13 years as a CEO now, the two big pain points you solved because of the advent of technology.
Well, actually, we are a very large system with multiple sites of care, including many hospitals and ambulatory sites. And without technology, without the electronic record that we put in place about 2 years ago, we would not be able to communicate. We couldn't integrate services more effectively, help patients navigate through the system. It is core to, I think, effective service and clinical quality. I think from another standpoint, we have really looked at digital health to help us connect with patients more directly. So how we provide information to our patients, whether it's laboratory results or it's the issues around how they order or set up appointments, we connect with them now directly. And that's been fantastic. And we look for a lot more innovation in that area.
You talked about sharing records. I have seen across the country that healthcare systems like to remain within their system. The records are not exchanged with other healthcare systems. And that becomes a problem because most of the time patients are with you. Sometimes they go to other organizations, and that becomes a challenge then.
Well, one of the great things about our new technology, which is called EPIC, is that it allows us to at least, because we don't have interoperability across the country yet in healthcare, but it allows us to connect with all of the other health systems that use the same technology. So within Southeast Michigan, as an example, there are several other systems that have the same technology, and we transfer records routinely, upwards of 1 million a year. So we are very focused on how we can create more interoperability. But the country as a whole, we need to have the federal government help us with that, much like they have with banking. We need to be able to exchange that information.
I have a consumer question, like a couple of them. One is in terms of security. Somehow patients have come to accept that it's important to get this digitized, and they want to share all the information with you. With very little regard for concern of security. Whereas come to financial transactions, they're very concerned.
Right.
Why is it so? Is it because they're more trusting with doctors and hospital systems?
I actually don't think they are. I think it's changed a lot. I think all of the security issues we have in society in general, I mean the cybersecurity attacks, we have challenges in terms of breaches of information. We have HIPAA, which is the federal regulation around privacy and security. We have invested so much in this area in the last 5 to 10 years because we need to protect our patient information. We also believe in private rooms because semi-private rooms, frankly, you can't protect information. So we are constantly trying to convert our semi-privates to more private rooms for that reason. So there are a lot of ways we have to make people attentive to privacy issues in healthcare. It's not just technology. It's also if you're in an elevator, not talking about a patient. There are a lot of things we have to do to make sure we're very focused on that.
Again, a consumer question, but a much broader one. Maybe it's more policy related. Why does it cost so much to afford healthcare here?
Well, there are many reasons. If you look country to country, we are a very complex health system in this country. We have multiple payers, unlike other countries that might have a single payer. It creates a lot of bureaucracy, a lot of administrative costs. Probably 25% of our costs in hospitals are administrative. So that's a big component. The other is that we pay our people better than other countries do. Our physicians make more money, our nurses make more money. And that's hard to, sort of rationalize, but I happen to think they deserve it. They're not overpaid, but I think, if you compare country to country, that's one of the differences.
Again, this is not your domain, but this is what people always ask me to ask when I get in touch with people like you. And we're not going to solve this problem here, but at least perspective would be helpful. Look at Great Britain, look at Canada, and here. Even a country like Cuba. Fairly decent healthcare system, much more affordable, even free. So why can't it be done here, or is there a possibility of having a quasi kind of a system?
I think it can be done here. The one huge difference, again, if you look country to country, is there's much more focus on primary care and prevention in other countries in the world. We have not done that. We have been very specialty driven. Technology and pharma companies, device companies have been trying to innovate in so many areas, but that costs more money. Yeah. And the other thing we do, and it's a good thing, is our Medicare program over the years and the investments we've made in all of this technology has actually extended life. I mean, we are taking care of people fundamentally differently than we did 20 years ago. We replace joints today. We have heart technology and valves that can allow people in their 80s to have procedures done. We never did that. Yeah. So I think sometimes when we look at those costs, we have to look at, are there some outcomes, especially for older people that have really provided a higher quality of life, and I think we do that.
You mentioned that you'll be retiring soon, next month, but I see that you have a lot more to give back. Where do you think you'll be engaged?
Well, it's a next chapter. There are two things I'd like to reduce, my calendar a bit, and the stress from, leading a large healthcare organization for so many years. But I will be teaching at the University of Michigan. I'm also going to be serving on a number of boards, both public, private, and nonprofit. And I'm going to certainly continue to give back in Detroit, a place I love dearly.
Right. Thank you so much, and wishing you the very best.
Thank you so much.
Appreciate
it's
it.
a pleasure.